talk about the tests we here at Inclusive Natural Medicine like to run the most. I would say outside of standard labs, our specialty one that we do the most often is the food sensitivity panel testing. So this tests for 240 foods that you're either allergic or sensitive to. Now there's separation there. Allergic is IgE. Those are our allergic antibodies. Those are the ones who flip out anytime there's something in there the body doesn't like. So think of like bee stings or shellfish, even like the swelling of the lips, the swelling of the throat, the large lumps, the itchy hives. That's allergy. Talking about sensitivity, we're talking about IgG. The body is sensing something. It doesn't like it necessarily, but it's not going to flip out. It's just maybe going to make you feel a little, this could be like headaches or fatigue or bloating or diarrhea or constipation, all these different things from a food affecting your system. We use food sensitivity panel, one, to determine is a food part of the problem, but also to look for leaky gut. If you've got food showing up, two foods showing up, that's probably the food itself and your body not liking it. If you're getting like 20, 30, 40 foods all red flagged in your report, that's not the foods. The foods aren't the problem. Your gut is. It's letting in too big of pieces, and the body is upset about these big pieces being in the bloodstream when it shouldn't be. And so we get those antibodies going to attack and break down these things that aren't supposed to be there. That's why we use the food sensitivity to test for leaky gut. A lot of foods come up. That's a really big clue that, okay, it's not the foods, it's your gut. So the test we use, thankfully, can be done one of two ways. One is either a serum sample, so it can be filled in with part of your blood draw. If you're doing standard labs, we can throw a food sensitivity panel in at the same time. We can also do it with spot blood testing. This one's a little trickier. We have to prick your finger, and we have to fill all of these round holes all the way. So generally we recommend the blood draw. It's just a little bit easier. We can end up having to poke your finger many, many times. It's really better for like kids who maybe won't sit through a blood draw. Let's prick their fingers and get this filled out. But again, either way we can do that. So if you have concerns, if you think you've got some gut issues going on, if you're worried about how many foods are affecting you, come on in and get tested with the food sensitivity panel.